Hello, ladies and gentlemen. Again, it's another time. My name is Isaac, Simple and Real. Thank you for watching my channel. Today, I want to talk about something very special to my heart. Remember, this is the channel where you should talk about HIV prevention and also more about stigma reduction or averting stigma. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Now, allow me to talk about HIV prevention during breastfeeding, especially for mothers who live with HIV virus. This is something that most people are not informed, but it's something that has been practiced in this country, that is Kenya and other countries, for the longest, almost now 20 years. People have been using preventive or prophylaxis to their children while they are breastfeeding them. Have you ever heard of HIV exposed infant? Other people call it HAI or HIV exposed infant. Who is an HIV exposed infant? This is an infant born from a mother who is HIV positive. The mother may be on treatment or not on treatment. Now, what do we do to prevent this child born by a mother who is HIV positive from acquiring the virus? There are several ways that we prevent a child born of the mother who is HIV positive from acquiring HIV virus. Number one, during pregnancy, it is now a requirement that every woman has to be tested HIV virus. And how do we do this? During the ANC or antenatal care clinics, these mothers are required to be tested before they are attended by the attending nurse. This makes it very possible for us to be able to make a diagnosis of a mother who is HIV positive way before she delivers. Also, during delivery, for in case a mother missed to be tested during the ANC, a mother is always tested for HIV. Now, why is this so important that a mother has to be tested for HIV immediately during delivery or during that labor time? It is important because the prophylaxis or HIV exposed infant prophylaxis is usually initiated within 2 hours after delivery. Do you see now the rationale? Yes. Now, and how do we do the follow-up of a HIV exposed infant to ensure that they are raised HIV negative? Number one, any child born of a mother who is HIV positive, whether previously the mother was on treatment or not, they are initiated on 2 main prophylaxis the first 6 weeks. And this is a syrup zidovudine, which is an antiretroviral drug, and nevirapine. These drugs are very effective in preventing this child from acquiring HIV virus either during breastfeeding or any blood contact the child may have gotten during the process of delivery. Now, that is the main importance. Also, as the child progresses, we usually continue this child now on nevirapine syrup only, which is increased in dosage as the child grows up to the time the child will stop breastfeeding. Usually, we recommend the child to be breastfed up until 18 months. But depending on different mothers, a mother may decide to breastfeed his or her child up to 1 year. Now, when you discontinue breastfeeding, the risk is discontinued. So, usually we encourage the mother to continue with the prophylaxis at least 28 to 30 days, and then they can discontinue safely. Now, this is how HIV exposed infants are prevented using prophylaxis, nevirapine during breastfeeding, and immediately after delivery, nevirapine and zidovudine. Now, how do we get the assurance that the baby or the infant has not acquired the virus? Now, during the process of breastfeeding, this child is tested. And considering that the child contains or has the immunity or inherits the immunity from the mother, we do not do an antibody test. Usually, we do a DNA PCR test instead. This is how we do it. We do not do it at birth, although it is usually recommended at 0, but we do not usually do it at 0 days. We usually start it at 6 weeks. Then, when it is negative, we repeat it again at 6 months. If it's still negative, we do another DNA PCR at 12 months. Now, if it's still negative, we do it now, because now the acquired or the child has now developed his or her own immunity, and the immunity of the mother has depleted, or the antibodies of the mother has depleted from the child. Now we can do an antibody test at 18 months. Now, when do we discharge this child from our follow-up clinic at the comprehensive care clinic? This child is usually discharged at 24 months, where we do a hair cohort analysis, and we can discharge them as HIV negative or HIV positive. Now, what if this child, the DNA PCR turns positive or shows positive at 6 weeks? What do we do? We usually do a repeat DNA PCR. Now, when this repeat DNA PCR is consistent as HIV positive, we do not hesitate. We discontinue this child on prophylaxis, and we initiate this child on antiretroviral therapy. But do we still do DNA PCR at 6 months? Yes, my answer is yes. And also, something I had forgotten, we also do baseline viral load for this child who has been diagnosed at 6 weeks. Are we together up to this point? Thank you. This is all I had to say today, guys. If you have not yet subscribed to my channel, kindly subscribe. This is my appeal. And also, if you have any question, any comment, any kind of clarification you may need, you are free to do so. Thank you, guys. God bless you. Also, guys, remember that being positive about HIV is not necessarily being HIV positive. Bye-bye.